Okay, so when you guys come in for the focused exam, what you can expect is that you'll pick a number out of this hat here, or fishbowl. So these have numbers on them, like number 4. So in your discussion board this week, your scenarios, your symptoms were numbered, and that's how we're going to determine what scenario you get. So today we're going to do right ear pain, and you all will be the student, and how this works is like role play. So I'm going to be the preceptor, I'm going to be the patient, and then I'm going to be the faculty member that talks to you afterwards. Okay, let me grab a sheet. Okay, so today our student or our patient is right ear pain. Okay, so first thing I'm going to ask, and you guys can, as you want to answer, what do you want to know before you go into the room to see this patient? The nurse came and told me we have a 34-year-old female with right ear pain. What would you like to know before you go in the room? Anybody? Vital signs. Vital signs. Temperature is 99. Heart rate is 97. Blood pressure is 120/80. O2 saturation is 98%. And what's the other? Pulse. 70. 70.
Onset of symptoms?
Onset of symptoms, I don't know, I haven't seen the patient yet.
History? They don't. Okay.
History, past medical history.
Yes.
We have a history of depression. No other history.
Allergies?
Allergies. No known allergies.
Current medication?
Past medical history, let's scratch that, we have depression. Did I say that?
Mm-hmm.
Okay, for past medical history, we have depression. Medications, fluoxetine, 20 milligrams PO Q day.
Aggravating symptoms, or what relieves the symptoms?
I don't know that yet because I've not seen the patient.
Oh, yeah. Immunization status?
Immunizations, she is current with her childhood immunizations. You may want to, and when you're in the room, ask her about a flu and pneumonia vaccine if she needs it.
Her age?
Age, 34. Are we good? Okay, so that's the beginning of the exam. So now you would go into the room and see the patient. So now I'll play the role as the patient. So I need someone to step in and demonstrate what you would say to the patient who comes in with the right ear pain.
Introduce myself. I'm Scott. I'll be nurse practitioner examining you today. Nurse practitioner student examining you today. Tell me what brings you in?
My right ear has been hurting for about 4 days.
About 4 days.
Mm-hmm.
Has it been constant or coming and going?
It's pretty much constant. It's kind of the pain kind of shoots and goes away, shoots and goes away, but it's all the time.
Okay. Does it seem like anything makes the pain shoot and go away, or?
No, it's just random. And the pain kind of worsens when I swallow.
All right. Scale of 0 to 10. 10's the worst pain ever. How bad is it right this moment?
About a 7.
Okay. And how bad is it at its worst?
A 10.
10. Have you been around anyone else who's sick lately?
No.
I can help them out too.
I'm sorry.
Just so they can help you out too.
Oh,
It's
right.
okay.
You guys
You're
are
not on the
fine.
spot here.
Yeah.
You're doing a great job though.
Yes, you are.
So it's constant? So it's constant? then?
Yes. Mhm.
You could ask if there was any injury to the ear.
No injury. No.
Noted any drainage?
I've not noticed anything coming out of the ear, no.
Have you recently had a cold?
Yeah, my nose has been running some, and a little bit of a headache, sneezing,
Any sore throat?
little sore throat, yes.
Does anything make it go away? Did we already ask that?
I have taken some Tylenol, and it does help with the pain some.
Does the pain radiate down to the shoulder?
No.
How long have you had the cold?
4 days. These cold symptoms have kind of started the same time as my ear pain.
Have you tried anything to alleviate the cold?
Not really, no.
Have you had fever?
I think they told me today my temperature was 99. But I've not taken my temperature at home.
Has it affected any of your normal activities that you do?
Just, it's painful, and when I go to work, it's just aggravating. And I've put a warm towel on my ear trying to relieve the symptoms along with the Tylenol. Just don't feel real well.
Have you missed any days of work?
No.
Any chills or sweating?
Any what?
Chills or sweating?
No chills or sweating.
Any dizziness?
If I stand up, sometimes I'll get a little dizzy, and that just started with this ear thing.
Okay, so we have the ear pain that doesn't radiate, but you have a headache. So what about a sinus history? Do you have any history of sinus allergy?
Yeah, it's usually seasonal allergies, and I'll take Claritin sometimes, depending on the season. But I hadn't started the Claritin yet this fall.
Do you have, I didn't hear this, do you have a history of ear problems?
I've had ear infections before, and I know that's what this is.
You had ear surgery?
No.
The drainage that you've been having, is it clear?
Yes.
Did you have to have tubes when you were a small child?
No. But I did have a lot of ear infections when I was a child.
When was your last ear infection that you can recall?
Probably last year around this time.
Any decreased hearing that you've noticed from that ear?
No.
What were they able to do last time you had an ear infection that helped relieve?
They give me an antibiotic, and it was cleared up about 3 days.
You recall what antibiotic that was?
Mm-mm. It's probably in my chart.
And you said no head trauma? You said no head trauma?
No.
Okay.
Have we asked about your breathing? How's your breathing?
That's really the physical exam. So we've talked about the review of systems. We've went over well, actually this part was really the history of present illness. So next, you would want to do review of systems.
We might want to tell you we're very sorry that you're feeling so.
Did you learn that from Tina?
I did.
Yeah.
I'm sorry you're feeling this way.
I never have enough education or
Oh,
information.
courage.
Yeah.
Me too.
I'm sorry, I feel bad too.
So sorry.
Thanks.
Thanks for saying that.
Let's see what we can do to help you feel better.
Yeah. So now we'll talk about review of systems. So what, and you've already touched on it because you were asking about associated symptoms with that being the sinuses and things like that. So what review of systems would you want to ask for this patient? This being a focused exam, you don't want to do all the body systems. So you've asked general, fever, chills, HEENT,
Respiratory.
respiratory, making sure you don't have a pneumonia or bronchitis,
A little bit of neuro too, like dizziness.
dizziness, yes.
Cardiac. Listen to the heart.
I've not had any chest pain. Okay.
Lymph nodes.
And cardiac, what exactly would you want to ask for a cardiac?
Any history or anything like that would be pertinent?
Well,
or
we already
listed?
said that we didn't have any past medical history of cardiac problems. But let's think about review of systems for cardiac. What do you ask the patient if you were suspecting something cardiac? Chest pain,
Shortness of breath.
palpitation, shortness of breath,
Pain that radiates into the neck and the jaw for a female.
yes, edema. Okay, any other body systems that you all would want to do for this scenario? So when you do this, we're not gonna count off if you do an extra body system, but you all caught the pertinent ones. Okay, so now we'll do, this is how your exam goes, by the way, when you're in the clinic. So now you're gonna focus on the physical exam. Based on what you've learned so far from the chart, the interview of the patient, the review of systems, what do you want to look at and assess?
I want to focus on my eardrum.
Okay, so, the ear, okay, so what do you wanna do to the ear?
First we're gonna assess, this is inspect. the ear, the
Inspection,
outer side.
okay, the inspection, it looks just like this, except for it's the right ear. Okay, so basically, you see, no swelling, missing earring, because I forgot it today. You would see, no drainage. You would see a patent, external auditory meatus. What else do you wanna know with the ear?
Compared to the other side.
It's the same.
It's the same.
Uh-huh.
So you wanna pull up.
You pull up, there is no tenderness.
Push on the tragus.
Push on the tragus, there's no tenderness. Otoscopic exam. Okay, so you get the otoscope, you're able to insert the speculum. What you see is a red bulging tympanic membrane. And the canal is a little bit red. And you can't see any of
How would you deal with someone with these symptoms? You're very suspicious for middle ear infection, but the eardrum's obscured by wax.
In real clinical practice, if I see that the eardrum's obscured by wax, a lot of times I'll try to maneuver the otoscope to move the wax if possible.
Mm-hmm.
If not, you could, do you guys have any suggestions?
Little correct.
The correct.
Yeah,
But
just
you-
scoop a little bit out.
You wanna make sure that you're able to see the eardrum before you say that they have a notitis media.
That-
So
that's what
you
I'm
wanna,
saying.
you want to visualize the
Exactly,
tympanic
that's what I'm
membrane.
troubleshooting that.
Mhm. And
Yeah.
they're probably gonna wanna smack you,
Yeah,
but you
exactly.
have to
Because
see
it's
the
gonna be
eardrum.
painful, yeah.
But you have to
Yeah.
visualize the eardrum.
You
Sorry,
have to be real careful doing that though, because if
If you
you
don't-
do have a red bulging membrane.
you can actually
Yes.
perforate it.
Yeah. Okay.
So would washing it out be a better option?
No.
Pressure in there, wouldn't it?
That,
You're
that-
already dizzy.
And you might have a small perforation that
And
you
you've
don't
already
know
got
about.
pain, and exactly, you could have a perforation, and you never put anything in the ear.
Just enough to
Cure it,
see the
yeah.
membrane, that's all, I mean, you don't have to clear it all out, just enough so that you can see that tympanic membrane.
What else do you want to assess?
Nose and the mouth.
Oh, the nose. So you inspect the nose, and you see that it's redness around the nares. And then you want to do an internal inspection. You see that there is some swelling and redness on the turbinates. There's no septal deviation. What else?
Clear
How
drainage.
big are maxillary?
You did see some clear drainage.
How big in the maxillary and frontal?
Oh, yeah, palpation. So a little tenderness in the maxillary and frontal sinuses. The eyes, the sclera is a little red. There's no signs of infection though, like yellow drainage. Throat. You look inside the throat. There's no dental caries. The tonsils are 2+, slightly red. Uvulus midline rises with phonation.
Rises with what? Say that again.
Phonation.
Any exudate?
There is a little bit of clear exudate in the back. Probably that she's got the postnasal drip. Lymph nodes. So occipital lymph nodes, you're not feeling anything. The posterior auricular, you feel a couple lymph nodes less than 1 centimeter, shoddy. They're movable. Little tenderness, right ear. Not left.
Any anterior, posterior cervical nodes?
Anterior cervical nodes, not really, you can't feel them. Posterior cervical nodes, there's no lymphadenopathy.
Test hearing.
Hearing, so whisper test is negative.
Did you look in the other ear to compare?
Oh, that other ear looks perfect. Pearly gray, landmarks are visible.
And that's just a good thing for people to look in the non-tender ear first,
Yes,
and then look in the
yeah.
affected ear.
I always look at the ear that's not affected first.
Would we like to listen to your lung sound?
Yeah, so the lungs, we listened posterior, clear to auscultation bilaterally, all lobes, anteriorly as well. You hear my heart? Regular rate and rhythm, no murmurs, no ropes, no gallops, no heaves, no lifts.
Any rashes on the skin?
No rash. Okay, are we done with physical? Okay, so the next part of the exam, what do you guys think's going on? Because you're coming out to talk to the preceptor now.
What are your differentials?
What's your main diagnosis? What do you think it is? Okay, and what are your differentials? Two. Allergic rhinitis, sinusitis,
We didn't,
upper respiratory infection.
strep throat, should we have done a swab even though she had a little bit of soreness? There are no exudates.
No exudates. What else? You could have already ruled it out with questions you asked. You ruled out otitis externa, right?
Oh, yeah.
Yeah. And you also asked about trauma. I didn't get hit. There's perforation.
I didn't even think about that.
Okay, so we've got differentials and we've got our diagnosis. Now we'll talk about the plan. What would you like to do? And what you just talked about doing the strep, that would be part of the plan. Yeah. So if you were going to do a strep screen, that's where it would go in the plan section. But I wouldn't necessarily do a strep screen on this patient. Okay, so what do you want to do for this patient? We're looking for basic nursing interventions and what you think you would do to treat this. Antibiotics. And does anybody know, where would you look if you didn't know in the clinic what antibiotic to give? Huh?
They have a book and I can't remember.
5-minute clinical consult would have it. Anything else? Hippocrates, you could look up the antibiotic and see if it's got otitis media on there.
Isn't there a book that describes like what antibiotics work for the general area that you're working like?
Is it Merck? Sanford's Guide for Antimicrobial. Yes.
Also, guys, etsu.edu/medlib, MEDLIB, the medical library, has Dynamed on there. That's really good for you to use too. You can search medications or diagnosis. Okay?
And it's free.
And it's free to you.
Another thing you can use that's free on your phone is the CDC antibiotic. If you download that on your phone, you can actually look up by system what antibiotic is first line for each diagnosis. So it's really helpful. Okay, what else do you want to do for this acute otitis media?
Tylenol for comfort.
Oh yeah, we're going to do some Tylenol. Which would be better, Tylenol or ibuprofen?
Well, Tylenol is just for pain, but, Motrin can be inflammation and
Yes.
pain,
So I normally tell them to do ibuprofen, because not only is that good for inflammation with the ear, but it also is probably going to help the inflammation in the sinuses and things. Yeah.
And just remember, for your plan for your focused exam, you're not gonna be expected to give the exact antibiotic that you would use to treat. As long as you can state that you would prescribe an antibiotic, that you're good, okay?
Do we need to
Mine's-
do anything with, for the focus assessment, we don't need to do like a depression screening or
If
anything with that
You would
depression?
need to do a depression screening if you had the patient with depression.
And you have a
Yeah,
history of
the-
depression,
Yes.
so.
The chief complaint, well, you could do
She has a
one on
history
her,
of
she has
it.
a history.
Mhm,
But
so-
the chief complaint of, oh, I'm crying all the time, I don't enjoy stuff, for sure you would do a
And-
PHQ-2, which would probably lead you to a PHQ-9.
Yes. And suicidal and homicidal ideation. That's what we're looking for with that one, for sure.
You could do like a warm compress or something.
Warm compress, yeah. Or the hot towel she was using, that would help for comfort. You can also do a heating pad, but make sure they tell them not to go to sleep on it, because they could get burned.
Increased fluids, and would you like say something about yogurt, eating yogurt to help prevent?
Yeah, you could do some yogurt to keep them from getting candidus infection. What would you want to tell them about that antibiotic?
Make sure you take the entire course.
Yes. And if you was doing augmentin, what else would you want to tell them?
Food.
Take it with food, because they're going to get an upset stomach. Anything else? You said fluids, forced fluids, and that's going to keep the secretions thin, make them
Rest.
feel better.
Mhm.
Rest.
Appropriate follow-up?
When do you want me to come back?
Like, if it gets worse, or
Yes.
if it still continues after the course of antibiotics.
Yes.
And what would be worsening symptoms that she should look for?
Sudden onset, severe ear pain, bleeding from the ear, fever. Yeah.
Very good. Okay, so this is an example of the focused exam. Once that's complete, then we will go through this last portion with you. You was able to construct a feasible evidence-based plan. You all did really well. You relayed basic nursing interventions. You remembered pertinent diagnostics to order. So you thought about strep, but you didn't really want to do the strep screen. So if you had somebody with cough and rhonchi and everything, that you might think about an x-ray. And follow-up, that's part of it too. I always think about follow-up before the patient leaves. Otherwise, you'll never see them again. Another thing to think about is you asked the preceptor about immunizations, and they told you to ask about the flu pneumonia vaccine. Did you ask? Did she have a flu vaccine this year? Yeah, so see how easy it is.
And guys, remember that you are predominantly, well, you should be in a primary care setting. So if we have this patient who does need a chest x-ray, more than likely we're going to have to order it, and she's going to be sent out to get the chest x-ray. It's not something that we can do right then and there. Knee pain, we're not going to be able to do an MRI, okay? So you could state you're going to order an MRI, but you probably won't have those results back yet, okay? I know a lot of you work in the hospital where things are just like lickety-split sometimes, maybe, but not in primary care, okay? Remember what your role is now as an NP student. And Vicki, did you have
That's the
some?
same, I've been looking at the, discussion 5, the discussion board, and another thing people are ordering a lot of times are labs like troponin. You never would order a troponin in primary care.
Why?
Yeah.
Just some
That'd be too late.
Right.
You're gonna wait for that to come back if you really think the patient's having an MI? But.
One
so-
thing, you have to have follow-through, but what's the other reason why you would never order troponin in primary care?
Yeah, like she was saying, I mean, it's just like you don't wanna wait for the turnaround of that.
You have to do 3 sets. What if you
The
only did
series.
1? You're,
You're liable for it.
But if you're right, if you're ruling things out and you do a troponin and you send the patient home and they come back and the troponin was 12, and you missed it, yeah.
Never do
So
the
remember
troponin
what
in
you're
primary
setting
care.
is, you're in primary, this is primary care, this is not ER, this is not ICU, you're in primary care, so you have to work within the scope of what you can do in primary care, and then refer out if you need to, or send them to the ED.
So that's the example of the focused exam. And another question.
So this patient has got a temperature of 99
Mhm.
and she's not had her flu shot, so normally they don't give the flu shot if you're sick and you got a fever, so how would you?
Is 99 a fever?
Well,
No.
it's a low grade.
And actually, if you look at CDC, it says severe febrile illness. So
Okay.
if they've got a
So we're good to
temperature
go
of
before you get
100,
your
I'm
flu
gonna
shot
give
done
it.
today.
Because if you didn't do the flu shot, guess what? She probably ain't gonna come back till next year when she's sick again.
She has the flu.
Or if she has the flu.
Okay, okay.
Yes.
Yeah.
Mm-hmm, mm-hmm. That's
And
a good
if you take
question,
the
though.
Fitzgerald exam prep, she's gonna tell you, immunize, immunize, immunize. If you've got them there, give them everything that you can.